Hi, I'm Dr. Mike Bradley. I'm a pelvic floor specialist, and I'm going to talk to you a little bit today about what we do in pelvic floor rehabilitation therapy, specifically for men. So one of the things that a lot of men come to us with is pelvic pain. They come with the inability to empty their bowels. They have urinary issues. They have leakage. They have drippage. They have incontinence. And what we do is we specifically focus on the pudendal nerve. So the pudendal nerve is what breaks us or changes us a little different than what you would see with like a pelvic floor physical therapy when you're dealing with pelvic floor rehabilitation therapy. And with pelvic floor rehabilitation therapy, we focus on the muscles of the levator ani and the bulba cavernosa reflex and the muscle itself, and specifically the pudendal nerves. Now, the pudendal nerves are the nerves that control pee, poop, sexual function, and pelvic-based pain. These nerves are located they kind of follow out of the S2 through 4 of the back. They come down and then they branch off, as you can see, into some very important parts of our body. That includes the rectum, so our ability to control our bowel movements. It goes into our prostate. A lot of times prostatectomies cause injury in this. And then it goes into our bladder, and then it comes up and it goes into the penis and testes, which might have pain associated with that area. When we focus on these particular nerves and the muscles of the levator ani, we're able to get really, really good improvements in those particular symptoms. So again, the pudendal nerve and the levator ani muscles are the focal points of what we do in pelvic floor therapy. Okay, now that we explained why we're doing what it is, let's talk a little bit about what we're going to actually do today. So the first thing you're going to do is you're going to get your pants and underwear off. You're going to then lay down back to the table. You're going to cover up with the white sheet that's given to you. And then we're going to place, the technician's going to come in and we're going to place two things on you. The first thing that we're going to do is we're going to put these electrical stim pads directly over the pudendal nerve that I talked about before. So this pad is going to go directly over this part of the body, and you're going to have two of them, so you're going to have them on both sides. This is going to help stimulate the branches of this pudendal nerve that we talked about earlier. And that's going to help get the control aspect of the levator ani muscle, where you're able to squeeze that muscle and contract it appropriately and have proper control. This is what's going to help be able to get us control of both our bowels, our bladder, and sexual function with the prostate. The next thing that's going to happen is we're going to take this very little balloon. We're not going to go inside, but we're going to place this directly on the anal sphincter, where you can see that it kind of goes right on this muscle group here that's called the bulba cavernosa. That muscle group then is going to first contract, but it's going to also ignite the levator ani muscle, which is going to go up inside. So this isn't going to go physically inside you, but the balloon itself is going to measure your ability to contract the muscle. And based on your ability to contract the muscle, that will allow us to be able to assign exercises to help get this muscle active and strong again. That's what this procedure is going to do. It's not going to hurt. There's not going to be any pain. It's going to be very simple. And at the end of several weeks of this, you're going to see real improvement of your symptoms.